Howdy, hi, hello, and welcome back. So, now we're going to be talking about your basic counseling skills, how these are applied to a group setting. So, for counseling in itself, you should be able to do all of these things, right? I'll go through them very briefly. So, reflecting and paraphrasing, not parroting your clients, but repeating back to them the main themes that they gave you while they were talking. Summarizing, same thing, it's just over a longer course. So, typically at the beginning of a session, when you're reflecting on like your past session, or if you're talking about you're ending the session and you want to summarize everything that you guys went through. Questions, you should be able to use open questions, which are questions that are not simple yes or no, but they have to elaborate on them. You have silence, very important, powerful tool. You have your rapport building, being able to build a relationship with your client. Immediacy, which is focusing on something that's currently happening, like, hey, I noticed that you're shaking your foot a lot when you said that. Focusing on what the issues are. A lot of the times they'll ramble on about a bunch of different things, and being able to kind of micro focus on, yes, that is a lot, but let's focus on one thing today that we can fix in this session, or we can talk about in the session. And then attending, which is just being present with your client, as well as the solar, which is like sitting squarely, having open arms, leaning towards them, effective eye contact, and remaining relaxed and attentive. Now, in addition to all of those counseling skills, you are going to have to apply them to a group, but you're also going to have to do some other things like I mentioned in the previous video, linking, which is where you connect to people's stories or connect to people by their similar experiences, blocking, which is preventing a person from like taking up too much of the time, or preventing unhelpful behaviors from happening, or stopping the unhelpful behaviors if they have been happening. I'm so sorry. I am not, these emails are ugh. Then we also have setting goals, initiating, evaluating, giving feedback, restating, which is not on there, or kind of like paraphrasing. We have questioning. We get paid to be nosy, ask a lot of questions, interpreting their feelings, using reflection of feeling, which I've made videos on before. And it's basically just trying to identify the feelings that they're experiencing, facilitating the process, suggesting, protecting, disclosing oneself if it helps the group. Only disclose if it's going to help. Don't disclose for your sake, just for theirs. Modeling your behavior, and terminating the group. So, those are your essential skills to be a group counselor, as well as a regular counselor. We've talked about all of those other things. You have to be able to deal with resistance. There are different types of groups, just like sum everything up. Homogeneous and heterogeneous. So, homo means same, hetero means different. So, homogeneous will typically have similar presenting problems, whereas heterogeneous will typically have different problems. You have open and closed groups, very important to know the difference. Open groups, people can come in and out whenever you want, whenever they want. Closed groups, once it closes, nobody else can come in. So think it's a closed door policy, whereas it's open. Some questions that I've seen are like, what is true about the group size number? So with closed groups, if you lose, everybody just stops showing up, you lose your group because you can't get any more. And with open groups, people can come in and out. So your group number is typically more stable. But with closed groups, you typically have more cohesion because it's the same people seeing each other over and over again. Group size optimal range is 8. I've seen like 6 to 8. And then with children, you always want less. So with children, 4 members or 3 might be ideal. The duration depends. Typically, the best times that I've seen are like 60 to 90 minutes for every group. You should be screening as a group leader, so figuring out, are they a good fit for the group? Characteristics and their motivation should be. And then we have making sure you go over confidentiality. Make sure you tell them confidentiality is not a given, because you can't stop other people from saying what they need to. Going over the norms, as well as creating norms with your group. And then I think that's it. The only other thing that I should, and some names to know in case I didn't say that, Michael Waldo, he suggested different levels of leadership functions depending on the group. And then Jacob Moreno, big on groups. He's the one that created the term psychogroup therapy, theory of spontaneity, as well as psychodrama. You have primary, secondary, and tertiary groups, which I think I've also talked about before. And then, of course, just knowing like the different theories and the modalities that you can do. So you can have different, depending on what theory you follow. You can have a psychoanalytic, a gestalt group, a transactional analysis group, cognitive behavioral group, rational emotive behavioral group, reality group, and then Fred Adler's group, Adlerian existentialism. All the different theories basically can have their own group. And I can do a theories video next to just kind of sum them all up. I have individual theory videos, but I've never done all in one. Scary. And that is groups. Yay.